Hi, Annette. How are you? Since the last time we spoke, we had spoken about the facelift and the brow lift. So, what are your thoughts now?
I'm ready for the facelift, Dr. Hayworth.
Dr. Haworth, how young is too young for a facelift? Well, it all depends on the context. For example, if you are hypothetically exceedingly genetically blessed, like a superhero without any folds or wrinkles, and you're 80 years old and you want to come to the plastic surgeon and get a facelift, well, you're too young for a facelift because you don't have any folds or wrinkles that will benefit from a facelift. On the other end of the spectrum, let's say you've lost 150 pounds and you're 22 years old and you are very much sagging and you look a deal older than your stated age. Well, that patient wants to come in and look better so that their external self matches their internal self. So, what they're suffering from is age dysphoria. In other words, your internal subjective self doesn't feel aligned with your objective external self. Plastic surgery sort of reduces that dichotomy. So now it is in sync and we feel great and our self confidence raises. Good plastic surgery is invisible. Good plastic surgery makes people feel better. Simple. So, if somebody's coming in and they're 22 years old and they look a lot older than they should, am I going to deny them that surgery? In other words, as a plastic surgeon, I operate on a problem, not on an age. But I'm not suggesting that there aren't certain surgeries that have minimum age requirements in order to perform them safely. For example, rhinoplasty. Rhinoplasty, aka nose jobs, should basically be performed only after the age of 14 or 15 in girls and 16 to 17 in boys. Why is that? Well, it's because the fact is, why is that? That's basically because, why is that? Because why is that? That is because growth. And why is that? That is because, and why is that? That is because the skeleton, the bony growth hasn't completed yet by the age. And why is that? That is because bony growth hasn't been complete yet. Girls generally finish their bony growth at the age of 12 to 13, but pretty much by the time that they're 15 years old, all of it has been complete. And in boys, it's a little bit later. Any concerns or questions, one could always get an x-ray of the left wrist and hand in order to determine whether bony growth has been complete. So, bottom line, what I'm saying is that. So, to conclude, I operate on an age and not on a problem. So, to conclude, I'm not suggesting that all plastic surgical procedures should not have minimum age requirements. One that comes to mind is rhinoplasty, aka nose jobs. The minimum age to undergo that safely for a girl is around 14 to 15 and boys 16 to 17 years old. It all depends on how mature they are in terms of their skeletal growth. We want the bony growth to be complete in order to prevent any unwanted surprises with the rhinoplasty results. If there are any questions, one could always obtain an x-ray of the left hand and wrist to determine whether the bony growth has been complete, and then one can proceed safely with the said rhinoplasty. And to conclude, I hope that your 2025 will be the best yet, because if you are happy, people around you will generally be happier. My gosh, if everybody is happy in this world, I think we'll have world peace and everything will be just Jim Dandy, right? Okay. So thank you for watching.